Most of us experience our dreams as a fantastic diversion from our daily lives. But for some, dreaming can become a frightening and painful reality. On this episode of Somnilopod, we'll discuss REM Behavior Disorder, a sleep disorder that can have consequences that reach far beyond the bedroom. I'm Jay, and this is Somnilopod. Hello, everyone. As I'm recording this episode, it is Derby weekend here in Kentucky. And for those of you that aren't local or that just simply don't follow sports, the Kentucky Derby is the first horse race in a series of 3 horse races called the Triple Crown. So since the Kentucky Derby gets to kick this series of horse races off, it's kind of a party atmosphere here in Kentucky. So people tend to go all out. There's lots of bright colors. Women wear big fancy hats. People put flowers out. Everybody's decorating their houses. It's a very, very bright, very vibrant time here in Kentucky. And I thought that it was an interesting juxtaposition to what we want to talk about today. I want to talk about a disorder called REM Behavior Disorder. And before we dive in, I want to do a little bit of a recap and see how much you remember about sleep cycles and what happens within them. Now, as you recall, we go through several different sleep cycles throughout the night. And within these cycles, we'll go through stages 1, 2, and 3, and REM, or rapid eye movement sleep. We do that several times throughout the night. And as you recall from our earlier episode, during REM sleep, 2 very important things happen. The first is that we're paralyzed. There is an extreme lack of muscle tone in our skeletal muscles. It's called muscle atonia. And fortunately, it is just the skeletal muscles. It doesn't affect other muscles like your heart or your diaphragm, things that keep your body going. So there's just this general muscle tone that occurs during REM sleep. Another important thing that happens is that our brainwave activity is just as fast, sometimes even faster, than when we are awake. So something really interesting is happening there. Now, I want you to stop for just a second and think about the last dream you can remember having. For me, it was a work dream, actually a work stress dream. I was trying to put together a report and I couldn't find the information I needed to put into the report. There were folders that I was looking to find in my office. So I was looking under furniture, I was looking on shelves, in drawers. It was very frustrating. That's a very typical dream for me. I guess maybe I'm a little too stressed at work, but it did have some action, not necessarily a whole lot of action. And you can sort of see where I'm going with this. With REM behavior disorder, the actual interesting part of it is in the name. It is a disorder of movement, of behavior during REM sleep. You know, that muscle atonia that I talked about, that most of us experience in REM sleep, simply doesn't happen for people with REM behavior disorder. That natural progression of the muscles relaxing isn't there. Fortunately, it is something that is relatively rare. It only affects about 1% of the general population. There are some specific risk factors for some people. Unfortunately, being male is one of the main risk factors. REM behavior disorder happens mostly in men, especially men over the age of 50. There's also a high correlation between other neurological disorders like Parkinson's and Lewy body dementia, certain types of multiple system atrophy, things like that. Some studies have found that in people diagnosed with REM behavior disorder, about 30% will go on to develop a Parkinsonian disorder or a dementia within 3 years of their initial diagnosis. And that number increases to 66% within 7.5 years. So it's not necessarily an exciting diagnosis. Most physicians, when they're talking with patients, just simply try to give them what they need to prepare them, just in case the worst does happen and they do go on to develop Parkinson's in particular. So how does this develop? How do you decide, or how do you find out that you have REM behavior disorder? Generally, it's going to start slow. Usually, a bed partner will notice that you may start to mumble increasingly in your sleep. You may have small movements throughout the night during certain periods, especially periods that are later in the evening. As you remember from our talk about sleep cycles, REM sleep the majority of it tends to occur in the last third of the night. So that's when the dreams are most dense, or where we have the majority of that stage of sleep. A bed partner may notice that during that period of the night, you have a lot more body movement, a lot more discrete vocalizations. Maybe you even start to talk in your sleep over time. Initially, the mumbling can't be interpreted, but eventually they begin to understand what you're saying, things like that. Now, generally, one of the specific diagnostic criteria is the use of a sleep disorder test called a polysomnogram. We've talked about it before. What we look for with the polysomnogram is the loss or the lack of that muscle tone during REM sleep. Now, that is not to say that every single patient who has REM behavior disorder will have a complete loss of muscle tone and they will get up and start acting out all of their dreams every single night, every single time they dream. That is not the case. There is, in a lot of patients, sort of a cyclic nature to the intensity of their episodes of REM behavior. Interestingly, they report that their dreams are a lot more vivid than they used to be. And often they have a lot more active content, running, jumping, fighting, struggling, a lot more emotionally laden experiences for them as well. So once a patient is diagnosed, then the physician will explain to them what they can expect with REM behavior disorder. So what's to do? Typically, patients are cautioned to remove any excess furniture from their bedroom. You can imagine that if you're getting up and you're walking around and acting out some of your dreams or portions of your dreams, you may bump into something. So covering sharp corners in the bedroom as well. Some patients will actually, the spouse may sleep in a different bedroom when these episodes are a little bit more active, just so that they can be outside and not necessarily be affected by it as much. We had the opportunity to work with a patient several years ago that was brought to us, or rather came to us, because he had broken his wife's arm during their sleep. And this patient, he and his wife lived above their business. He was having a dream that someone was breaking in, and he was fighting them, and it turned out it was his wife. The business they lived above was a gun shop. He was a gunsmith. So precautions that patients will take often need to include safety concerns. Now let's dispel some of the myths that are involved with REM behavior disorder. Now, it is not a psychiatric issue. Some patients will think, I'm just losing my mind, getting up, moving around at night. That is not the case. These patients simply do not have control over what they're doing. Also, it is not the same as sleepwalking. Sleepwalking is completely different. They are both movement disorders. However, I mentioned that the majority of REM sleep occurs toward the last third of the night, and that's where we'll see a lot more intense dream content. Sleepwalking occurs in a different stage of sleep. It actually occurs in slow wave sleep. The majority of our slow wave sleep tends to be toward the beginning of the night, the first third of the night. So sleepwalking episodes will happen then. Also, with sleepwalking episodes, patients don't report that they remember what they were doing in great detail. However, with REM behavior disorder, these patients do remember their dreams. And as I mentioned, these dreams tend to be very emotionally laden, very intense, very anxiety provoking. A lot of patients with REM behavior disorder also suffer from depression and anxiety. Picture that. Every night before you get ready to go to bed, you know there's a chance that you may get up and move around. You may do something that you have no control over whatsoever. You may even hurt somebody that you love. Imagine the anxiety and the stress of that, and the frustration and the helplessness and the hopelessness that you would develop as a result of that. Now, fortunately, for these patients that have such a hard time with this type of disorder, it is very easily treated. In many cases, the patients are treated with a medication called Klonopin or clonazepam. It's a benzodiazepine, and it actually works very well. 85 to 95% of patients respond really well to it. Also, melatonin treatment can help a lot of patients with REM behavior disorder. We've mentioned melatonin before. There is not necessarily a lot of consensus on why the melatonin works, but since there is some belief that since melatonin does help solidify our sleep cycles, that it may have something to do with that. Fortunately, it is something that we found to be effective, so if it works, great. So if you or a loved one has experienced symptoms related to REM behavior disorder, your first step is going to be to touch base with your physician. A lot of times, patients with movement disorders will go to a movement neurologist. Now, these are neurologists that are trained in a subspecialty of neurological disorders that do involve movement. So they are very well versed on taking care of not only REM behavior disorder, but some of the other types of movement disorders that we discussed that can be prevalent in patients with REM behavior disorder. Fortunately, the road is not necessarily as gloomy as you might think with REM behavior disorder. However, until you can actually get to the point where you're treated, it can seem very hopeless. So don't give up. Seek out some help. Talk to your doctor. Once they get you treated, you'll be back to dreaming like the rest of us. As always, I want to thank you for listening and thank you for sticking with me. Please follow me on Instagram, Facebook, and Twitter. If you have comments, questions, suggestions for episodes, please send those to me. You can reach me at j@somnilopod.com. And until next time, please do try and get some good sleep. Thanks.